Hello, I am Michael Covert, President and CEO of Catholic Health Initiatives, St. Luke's, as well as responsible for our Texas division for CHI located in Denver, Colorado. We welcome you to our organization and we're very pleased to have you a part of us. Today I have several individuals who will be joining me to try to answer some of your questions as we think about our future with you together. Remember, our mission is one of a healing ministry, and it's a fidelity to the gospel celebrated through human dignity and social justice. It is the basis for why we exist, and your becoming a part of us gives us that opportunity to extend out that mission. Today I have Denise Foose, who's our Director of Ministry for our organization, as well as Susan Bailey Newell, who is our Chief Human Resources Officer, and Dr. Jim McDevitt, who is our Chief Clinical Integration Officer, and has the opportunity also to be our Dean, Associate Dean for Clinical Affairs for the Baylor College of Medicine. So with that, why don't I begin with Denise. Whenever we start a session like this, we always start it with a reflection. It gives us a chance to center ourselves and to think about what our purpose is, why we're here, and who we serve. Denise?
Thank you, Michael, and welcome to our CHI family from your mission team. And so we begin today with a reflection, as Michael said, to help center ourselves. And I've been thinking about new beginnings and the excitement of the new beginnings and the challenges, yet the amazing opportunities. Yesterday I was privileged enough to be in a meeting at Apollo and meet some of our new teammates. And the energy in the room was just electric. And this scripture verse kept coming to me out of one of our sacred texts, the 48th book of Isaiah. And God is speaking to the Israelites in that, but I sense the words were meant for us today. He says, I am about to do a new thing. Now it springs forth. Do you not perceive it? I will make a way in the wilderness and rivers in the desert. It springs forth. It doesn't just limp into being. The enormity of God's promise to us in this coming together. We at CHI are humbled by this unique opportunity of coming together and learning from you. Two distinguished legacies in caring for people. We are grateful for our past and we're excited about our future together. May God's blessing shower upon this new thing. I look forward to coming and meeting you. Your mission team will come to each location, and we will be sitting down together and discussing how we can integrate your culture with our culture as a faith-based institution. I'll see you soon. Mike.
Thank you, Denise. So let me begin by talking to you a little bit about Catholic Health Initiatives, because you may not be aware of it. During all of this time and with the negotiations back and forth, thinking about GHPMA and how does that relate to the larger organization, it became important to me to help give you a little bit of a frame of reference. CHI is located in Englewood, Colorado. We are the second, third, probably largest health system actually in the United States, one of the two largest Catholic health systems. We are located in 19 states. We have 105 hospitals and approximately 95,000 employees, and it's a $16 billion operation. So very large for us. Now, when you think about Texas in particular, we have really three regions that we serve today. Obviously, the Houston marketplace and all of the hospitals, the 8 hospitals that we have here and around the area. I'll talk about our joint venture in a moment with Baylor. We're also located in Bryan College Station, where we have 5 hospitals. Several are critical access hospitals, very large physician group that's a part of that entity. We're also located in Lufkin and Livingston, Texas, deep East Texas, as part of the Memorial System. And they have 4 hospitals, one of which is a long-term acute care hospital. Our work with the Baylor St. Luke's Medical Center is a joint venture between ourselves, CHI, and the Baylor College of Medicine. And we're excited about its growth in now and in the future. And to be able to partner with a top 10 college of medicine in the United States, we think is a tremendous opportunity for us in serving the citizens of the entire region and those that you take care of, in particular where you work. So we're pleased to have you here. We're pleased to have you a part of us. We also have a relationship with the Texas Heart Institute that has been around, and you know that here for a long time. So between THI and Baylor, our working relationship with Texas Children's, and our continued growth in the community, we're really having an opportunity to serve and meet our ministry mission. So with that, let me turn this over to Dr. McDevitt to talk to you a little bit about what he does and our relationship with all of you.
I'm Dr. Jim McDevitt, and I want to join Michael and the rest of the team in welcoming you to CHI St. Luke's Health System. Very exciting day, and I specifically want to speak directly to the physicians in your group and also the PAs and nurse practitioners and advanced practice clinicians, those of you that are actually taking care of patients, because I think we have a really unique opportunity to build something special and different in this market, something the Houston greater metropolitan area has not yet seen. And I'll highlight just a few of those differences that I see. One is I am confident we are building something that is extremely physician-led. And when you look at what's happening in healthcare today with the drive towards value-based care, with the demanding baby boom population that's coming up, the challenges we have on reimbursement, doing more for less, for better outcomes, it's a little bit of an impossible challenge for us to meet. Impossible unless we fundamentally change, improve, alter the relationship with patients and how we deliver care. And we can't do that unless we have physician leadership. The healthcare system can't make up how we're going to take care of patients and impose it on physicians. Physicians have to be at the table helping to create this new healthcare delivery system. So we are creating a very physician-led organization of which you are now a part. Second, you will be professionally managed, echoing the issues around the MACRA and value-based care and what's coming down the pike. I won't say you don't have to worry about those things anymore, but you have professional managers at your side helping to manage your practice, helping you to understand the dynamics, and setting you up so you will be successful in the future. And that is our commitment to you as an organization. Third, Michael mentioned our link to the Baylor College of Medicine. To be linked to a top-tier academic medical center is an advantage. And what we're trying to drive is that advantage is not just the patina of academia, just not a nice thing that we have association with that brand, but how do we drive advances in education, continuing medical education, genomics, proteomics, metabolomics, out on a practical level to your practices to create strategic advantage to our organization and to make care better for our patients. And lastly, I would also echo Michael's opening comments about vision, mission, purpose. You are joining an organization that is extremely mission focused, that is in this business for the right reason, which is to take care of patients and to make the lives of people we serve better every day. So I'm proud to be part of this organization. I'm proud to be associated with the academic and the clinical components of the organization. I think we have a lot of work to do. It's going to be special and unique. And I just want to thank all of you, your group in total, but each individual in your group for becoming part of us and helping us to grow and succeed, particularly in the highly competitive and evolving northern Houston market. So thank you very much and welcome.
Good afternoon. My name is Susan Bailey Newell, and I want to echo again what Michael and Denise and Dr. McDevitt shared and welcome you into CHI St. Luke's Health. We are thrilled to have you. I, like Denise, had the privilege to come visit the Apollo facility, and had the same exact experience. A lot of energy, a lot of smiling faces, and we are really thrilled to become also part of your team. And as we went through our integration process when we became part of the CHI family, there were basic fundamental questions that our employees had that were, what's going to happen to my position, what's going to happen to my pay, my benefits, and will I have a job as we go through this integration process. So I want to be able to have this opportunity to just walk through a couple of those seminal questions for you. Because obviously integration can sometimes be scary, but our commitment to you throughout this integration process is to communicate what we know and when we know it, to treat you with absolute respect and honor the culture of your current organization, and also to engage with your leaders to determine how each of you can contribute to this integration process. So probably the first thing is, what's going to happen in the workplace? Is my job going to change? For the immediate future, nothing is going to change. We would ask that you continue to do your current role, fulfill your current projects, and continue to provide really outstanding, exceptional service to the families and communities and patients that you currently serve. If things change, we will communicate that as soon as we know it. Our commitment, again, is to be transparent with you. So let's talk about benefits. Your benefits will not immediately change. We are working with United Healthcare, Unum, and Aflac to continue to provide you with your current benefits. You will eventually come over to our CHI St. Luke's Health benefits, but right now you will remain on the same benefits. Comp and benefits. Your comp and your pay will remain the same. We will, as we go through the integration process, do a comprehensive review of all your pay practices and programs, and eventually you will align with the Texas Division's comp plans and practices. For your 401k, your current team, GHPMA, is working, and they will communicate with you about your current 401k plan. You will come onto our CHI St. Luke's 401k plan in April of 2017, and more details will be provided about that. And then PTO and vacation. Your vacation and your PTO and your sick leave will remain the same. You, again, will eventually come over to the Texas Division plans and programs, but that will be over. We will look at that over the next 6 to 12 months about how we effectively integrate with causing the least amount of disruption and the maximum amount of continuity for you and your team. So what happens in terms of immediate application process? You do not have to reapply for your job. You have a job. But there are going to be a couple of things that we're going to ask you to do as part of the pre-employment and joining the organization. We will ask that you have updated TB and vaccines. We will send you information. We will ask that you do a background check and drug screening. We will send you notification 72 hours in advance, and we will ask that you complete everything within 72 hours. And then you will get an email in your personal accounts and the email that we have of record. So please be looking out for that. Again, want to say to you as a team, we know that this can be scary for you. We will do everything possible to diminish any amount of concerns that you may have. Certainly there will be some changes, and we will communicate with you what we know when we know it, and we will work in partnership with you and your leadership team to have a smooth, seamless integration. We appreciate you, and we appreciate everything that you'll be doing into the future, and again, we're thrilled to have you as part of our team.
Thank you, Susan. Thank you. Let me share with you that when we looked at our strategic planning effort, particularly in our growth in the North County, we recognized, as you heard Dr. McDevitt comment, that we really wanted to be much more physician-oriented than we have been. It allows us to grow and extend ourselves out because all we do is what? We just take care of people. And so the way to do that is through all of you who have been doing it excellently for a period of time as long as your organization has existed. And so we're very proud to be associated with you, and that you chose us as much as we have chosen to work with you. It is part of a larger ambulatory strategy for us. Remember, what are we all about? Reverence, integrity, compassion, and excellence in what we do to serve our ministry, which is the basis for everything that we do. When I talk to our leaders, and those of you that are helping to lead your organization, I share with them the importance of finding the right kind of people to help take care of other people. I have certain expectations, and I will have those expectations of you as I have throughout the organization. So what are those? Number one, I expect you to be caring and compassionate people. Think about who we serve. Number two, I look for people who are conscientious and want to do a good job. Number three, I look for people who believe in the concept of teamwork and trust. Now, teamwork only comes over really good time. Trust is only built over time and through great communications. And that's what we're starting with all of you today. We believe in the concept of reward and recognition and valuing you and you valuing each other. And we believe in the concept of integrity, ethics in what we do. You see, ladies and gentlemen, I don't think it's too much to ask of you to be caring, compassionate, to want to do a good job, to be willing to work with other people, to value each other, and to be ethical. And if you feel differently, then maybe this isn't the organization for you, but I'm going to count on the fact that you do, and that's what's brought you together to make you the largest physician-led group within the region. And we're very proud then to be associated with you. So we welcome you again to Catholic Health Initiatives and to St. Luke's. I look forward to having the opportunity to get out there, to visit with all of you, to learn about what you do, and to help build our organization. So if no one has thanked you, let me thank you on behalf of our organization. And so with that, I will turn this over to Denise for a closing prayer and a reflection, and we'll look forward to visiting with you soon.
So in the Texas division, we've started a tradition of ending our town halls with a blessing. And I challenge each of you to do this in your meetings with your teammates, to offer them a form of grace as they leave. And so as a blessing is that, it's not necessarily a prayer in the truest form of the word. We don't look down with our eyes closed, yet we look around into the eyes of one another, where we receive that true grace and blessing. And so now may you receive this blessing. May God richly bless you as we continue our distinct legacies of healing. May you daily renew your commitment to serve with reverence and compassion. Go forth in the full confidence that God goes with you and sustains you. Thank you.